Hi, this is Dr. Terry Frankovich, the Health Officer for Humboldt County.
We got several questions from our local media partners for you today, so I'm going to ask them. We did limit them to 2 questions per partner, so we're just going to start off with K-Mud News, and they want to know what is being done to support healthcare workers on the front line.
Sure, healthcare workers are pivotal in this, and from a sort of overall public health standpoint, one of the biggest roles we have is helping to facilitate hospitals and clinics and that type of thing, and being able to access the personal protective equipment they need to interact with patients. So obviously these entities already store much of that, but through our state connections, we're able to sort of help continue the flow of that really important material.
Can you talk a little bit about the statistical challenges of reporting on the commercial labs?
So obviously reporting on our own lab is quite simple. We run our tests in-house, we get those totals, and we know results as soon as the test run is complete. The commercial labs are collected in the outpatient setting or hospital setting, and they are sent out to a lab, so there's that delay while they are sent out. Because COVID is a reportable disease now, testing shows up in our public health surveillance system. So we are able to look and identify throughout the day, we are in that system monitoring for both the tests that are being done and results that are coming in as well. And so we become aware of any positive cases done by the commercial labs in that way. And the other way also is calls from the providers, because providers get those test results as well, and because it's reportable, they contact us. So those are the 2 routes we use to get that information. What has been a little difficult with the totals is that when someone is tested, the information goes into the system at some point after it's submitted, and so basically we have ongoing case testing totals. And so we're not able to report on a daily basis the number done at a commercial lab or sent into a lab that day. But what we can report is how many test people have been entered into the system on an ongoing rolling basis, and then we can present the results as they come in. So it's just not quite as simple to give an accurate report in the same sense of being able to cleanly tell you that today commercial labs did 20 tests in Humboldt County. It just doesn't work that way.
And are people being encouraged to wear masks? And if so, how should they wear them? Who should wear them?
Sure. So basically when we're talking about the general public, there is no standing recommendation, for instance, from the CDC that healthy people mask. But I understand people's concerns and discomfort. The main thing that just like for instance a homemade mask can do is that if you are coughing and sneezing or doing those things, it helps to prevent those droplets from getting out. It's not foolproof, but it may help. The issue is that if people are ill, they shouldn't be out anyway. So I think that helps limit spread right out of the gate. The other thing about masks is that if you're using masks, people have to handle them appropriately. If your mask is dampened with your sneezes and coughs and you're handling it and not immediately washing your hands or that type of thing, then it's not necessarily helpful in preventing spread. So I understand people's concerns, but for general public, there is no recommendation right now that people walk around masked. The professional masks that are used, for instance, for healthcare workers in those settings are in short supply nationally. There is no question about that. And there is no question that we really need to have them in place in the healthcare setting in particular, as well as first responders, that type of thing, because these are the folks that are going to be delivering services to the residents when they become ill.
Sure. From the Lost Coast Outpost, is it safer for seniors to shop during senior-only hours? Or is the advice for seniors to stay inside at all costs?
So obviously the preference is that seniors remain at home. It's just the safest place for people to be. However, we understand that that is not possible for all seniors, and there may be instances where people need to go out to obtain their own supplies. And if that's the case, I think that I really applaud the stores in putting out these sort of specific guidance hours for seniors. I think the main benefit of that is it really just provides fewer people in the environment for seniors to be exposed to. And so I think it is protective in that sense, and I really, again, I applaud them for taking that step.
Absolutely. Can you talk about the difference between sheltering in place and self-quarantining?
Sure. So sheltering in place is a population level move that we use, a public health tool. But obviously, even with sheltering in place, people are out and about. They're able to shop. They're able to, do the things, for instance, to go to the bank or to the post office, that type of thing. When you are quarantined at home, you are at home. You are not out and about. The only exception to that for people who are quarantined or isolated is medical care.
Can you talk about healthcare facilities and testing? Who's equipped to do that testing and what does that
How does
look
that
like?
work?
Yeah.
So basically, people talk about test kits, and I think there's some confusion on that point. When we were first testing for COVID, health departments were receiving sort of kits that allowed us to test. That was just how the ingredients and everything came packaged. I think what people are talking about with this question is the hospitals or outpatient providers have just the sort of a kit that allows them to collect a specimen. And really that's just a swab and the liquid that the swab has to go into. The labs themselves are the entities that have all of the reagents and equipment to run the test. Right now, testing is not being done on site in our local hospitals or clinics. The technology for that is not there yet. That hopefully will be coming down the road and will make it easy for hospitals, for instance, and large outpatient labs to do testing on site, but it's not there. So right now, public health and commercial labs are the ones who are doing testing.
So just to clarify, the hospitals can take the specimen, but the actual test itself happens in a lab.
Exactly,
Okay.
Exactly. We have the only local capability to run the test.
Okay. And then what is the process for procuring tests? I think we already answered that actually.
Well, I think that the test kits themselves, the hospitals, as they utilize the testing supplies that we provide in terms of, for instance, the medium that the test goes into, we replace those to that entity. So if we get 5 tests in, we try and make sure that they get those collection tubes back.
Is that same for the commercial?
The commercial labs provide their own supplies, as I understand it, and then need to replace those, or the hospital gets those supplies, procures them in another way, and provides them to the commercial lab. So we do this for our public health laboratory specimens.
Okay. And then is public health taking any steps to contact the individuals who are on that bus from Humboldt State? Can you just talk a little bit about what Humboldt State is doing?
Sure.
Yeah.
And I understand the confusion on this point. I think one thing people have to remember is that while we can easily identify that there were these buses with students, we need to remember that there are people who have traveled back to the community to university or wherever in cars and their own vehicles and such. And so it's not just an issue of these particular students, it's an issue of just travel in and out of the community. I think HSU has been working very hard in a difficult situation. I think their goal has been really to minimize the number of people coming into the campus from other areas. And I think when they are not able to do that completely, they have been working really hard on implementing things on campus to make sure that social distancing is adhered to, and that people are really trying to be as safe as possible in that space.
What would public health be doing differently in the local COVID response if it had an unlimited supply of tests?
Sure. Well, I mean, obviously from a public health standpoint, it would be useful right from the beginning of a pandemic like this locally and in the various areas of the country to be able to broadly test so that you can pick up those infrequent cases out in the community. And then that can just give you a barometer to measure what's happening with the infection out there. So it's not a perfect world. And when we all stop to think about it, the first case of COVID, I think, reported out of China was New Year's Eve. We've come a long way in a short period of time. And the truth of the matter is that not only did a test have to be developed for this virus after it was genetically mapped, but the testing capacity in terms of the reagents and equipment needed, all of that had to be put in place. And I just think it's been a frustration for everyone, but I think we have to deal with the reality we're in.
Sure. And I just have 2 more questions for you here. Can you just address whether or not something is going to happen with our airport following these travelers?
Well, what I can say is airport operations are essential. Local health department or counties are not in a position to shut down air travel. It's a decision that happens outside our area. So I think, that while certainly my message to people is there should be no non-essential travel. It's not recommended in any shape or form at this time. Our safest bet is people staying where they are, not crossing back and forth between counties, other states, and such. However, we do have to recognize that there are people who are part of the essential workforce, people who may be, for instance, providers who need to move in and out of the area. And I think, logistically, we need to make that possible while minimizing everything that is non-essential travel. I mean, to me, at this point, if you want to protect your family and your community, and it is not essential that you leave this area, you don't leave.
Along the same lines, our last question here, one of our local news agencies wants to know how many confirmed cases would it take for residents to go on lockdown or a quarantine of the county, so to speak?
Sure. So, and I'm sure as people are watching out there, I don't know exactly what the question means by lockdown, if they mean that no one can leave their house for any reason. I think obviously practically that's a very difficult thing to manage. People need food, they need medicine, that type of thing. So I think what is, the answer to the question is there's no number that sort of puts that in play. I think everything we're doing is meant to basically minimize, and I think the current policies we have in place, if people adhere to them, are hugely helpful. And I think that, bottom line going forward, we'll be just watching this as it evolves in our community. But one of the most important things I just want to keep emphasizing to people, and I know they're hearing it all over, is we need to sit tight and really be apart from each other right now physically, even though I highly encourage people to be in contact with their friends and neighbors electronically, whether that's a phone, their computer, whatever, because I think that's hugely important.